While we wait for our guest of honor, Dr. Velji, to arrive, we are going to ask Courtney to do a quick get started because we know we're going to be on a timeline and we're hoping nothing came up for her. But we'll ask Courtney to do a quick little update and an intro to our panelists. And we'll get started and we'll wait for Dr. Velji. So thanks, everyone. I can see lots of people joining the call. It's a very exciting day for everybody. Thanks, Courtney.
Thanks, Leanne. So welcome everybody to our Horizons Project panel discussion. Very excited that everyone has joined today. So before we get started, just a few housekeeping items. We are going to ask that participants remain muted and with their cameras off for the duration of the panel discussion. And if you have any questions, please post them in the chat. We will be monitoring that and answering them during the Q&A portion of the panel discussion. And for any questions that we're not able to get to just due to time, we will be following up with an email to all participants with those answers. And just please note that today's session will be recorded and we will share it internally post-event. So I'm going to start by introducing who is here today. So I'm Courtney Holdsworth. I'm a manager in professional practice with our program. Good morning.
Dr. Velji's joined us. Wonderful.
We've just started a few housekeeping items and just getting to our introduction. So perfect timing.
Perfect.
Thank you. So I'm a registered nurse of 13 years and I will be your moderator today. I am a member of Team RVH for the past 5 years. I'm very excited to be leading the Horizon Project Working Group and to be moderating this panel today. So we have Dr. Karima Velji, who is the Chief of Nursing and Professional Practice and Assistant Deputy Minister for the Province of Ontario. Dr. Velji is a healthcare leader with a proven track record in fostering the engagement of the patient and system partners to drive innovative models of care, integrating research and care to drive next practice, and creating cultures to unleash the potential of high-performing teams to achieve stellar results. She has implemented innovative health human resource solutions within these models of care to ensure optimal scope of practice of all clinicians. She has held senior leadership positions in several academic health sciences centers and has operated a successful consulting company. Dr. Velji is a sought-after consultant for system-level projects and has led external reviews of several organizations. She is also a surveyor with Health Standards Organization Accreditation Canada. Dr. Velji's responsibilities extend to provincial and national leadership. She has held the roles of Vice Chair of the Board of Directors of Accreditation Canada and member of Board of Directors of Health Standards Organization, the United Way Campaign Chair for London Middlesex, and as President and Chair of the Board of Directors of the Canadian Nurses Association. Dr. Velji has cross appointments to the University of Toronto, University of Western Ontario, Ontario Tech University, and Nipissing University. She has won several outstanding achievement awards, including the Sigma Theta Tau Excellence in Administration Award, University of Toronto Distinguished Alumni Award, Ontario Hospital Association Margaret Comack Award of Excellence in Nursing Leadership, and the Award of Excellence in Teaching, which is student nominated, from the Bloomberg Faculty of Nursing at University of Toronto. She has been profiled in the Boundless Banner campaign as an outstanding alumnus of the University of Toronto. At the system and global level, Dr. Velji is a consultant to global sites, including East Africa, the Middle East, and Asia for policy of development of policy, credentialing, training, and academic plans. Next, we have Dr. Sarah Lankshire, the Associate Dean of Nursing Programs at Georgian College. A nurse for over 40 years, Dr. Lankshire has been an educator for 20 years, teaching in undergraduate and graduate programs, sharing her knowledge and passion for nursing. Sarah came to join the nursing faculty at Georgian College in 2014 and became the Associate Dean of Nursing Programs in July 2020, proudly launching Central Ontario's first standalone nursing degree program. Her research has focused on professional practice models, scope of practice, interprofessional collaboration, and innovative models of care. In recognition of her contribution, Sarah was inducted as a fellow in the Canadian Academy of Nursing. And finally, we have Leanne Weeks, our Vice President of Clinical and Chief Nursing Executive here at RVH. Leanne brings a unique portfolio of healthcare leadership spanning over 10 years, with 6 years in acute care at RVH. Leanne has a strong track record in leading successful change and quality improvement of clinical programs, and she prides herself on having the courage to initiate change, challenge the status quo, and thrive in an environment that supports exploring opposing perspectives to reach superior outcomes for patients and families. So at this time, I am going to turn over to Leanne to review the purpose of this panel discussion today.
Thank you so much, Courtney, and welcome everybody. So we know that staffing shortages, burnout, and backlogs are pushing our system to the brink. And we also know that healthcare sector job vacancies, they're at a high, and the number of new grads entering the workforce is not sufficient to meet our capacity needs. And at RVH, we're not immune to this problem, and we face the same challenges that lots of our peers do across the province. So to help address these challenges, and as a commitment to a balanced healthcare and a great workforce, we want to improve and look for strategies to retain our highly skilled team members. And here at RVH, we've started a new initiative called the Horizons Project. So the purpose of our panel today is to demonstrate how this work with Horizons, along with the key initiatives being introduced by the Ministry of Health and our strong partnerships with our academic partners like Georgian College, will provide RVH and the patients we serve favorably through these turbulent times.
Thank you, Leanne. And now it's my pleasure to turn this over to Dr. Velji, who will provide an overview of the provincial clinical work plan.
Hi, everyone, and sorry for buzzing in a bit late. The technology is what I will blame, or me and technology. The combination is not very good, but
No
I'm
worries.
so glad everything worked out. So anyways, apologies for that, but so nice to be here, and thank you for inviting me. I wanted to give you a glimpse. I've been in the role that Courtney introduced my long bio to you, but I've been in the role for just over a year now. And certainly before I came to the ministry, a lot of HHR programmatic work was underway to deal with the issues Leanne has just pointed out for us. But we've now embarked on a very robust HHR strategy, and it's not just us. Every jurisdiction in Canada has a singular focus on health human resources. And in fact, in all sectors, we are dealing with human resource challenges because for nursing, as you may know, the shortages that we had predicted about 15 years ago, the pre-pandemic shortages certainly came into play pre-pandemic, and the pandemic hit. And you know, when you put our system under stress, the seams will start to unravel, and that's what started to happen with health human resources. So it's a combination of predicted shortages and then all the changes that happened to workforce in every sector that played out during the pandemic and beyond. In fact, I would say the world of human resources today is not the world of yesterday. The workforce has changed, their expectations of work have changed, their expectations of compensation has changed. You can name it all, and we would say the world is our oyster. We can work anywhere we want, how we want, and people are exercising those expectations. So, and our systems have not caught up with it. So we are feeling the pinch every time we turn because we are still trying to fit around into a square. And in fact, the square has to change. So that's the thing we've started to push now at the Ministry of Health, that the name of the game for health human resources is innovation. And we are pushing innovation in what I would call 4 pillars or 4 buckets of work. And I'll quickly introduce them. So the first one is expansion of education programs. If we want to create health human resources, it does start with the education system. Sarah knows this inside out. But we are significantly pushing a very heavy-duty expansion of education programs for nurses and for physicians in particular. And then there are some minor expansions that are also taking place for other healthcare professionals. For nursing, it's a net new 2,000 nursing seats in the province, just in a matter of 2 fiscal years, 1,000 RPN seats, and 150 nurse practitioner seats. So kudos to our education sector and system, our colleges and universities, for rising really to that challenge, embracing those expansions and activating them. Some better than others, I would say. Some universities like Sarah's are examples. Examples we want to follow on not only how we do expansions, but potentially how we do bridging programs, how we compress programs and deliver the same standard of education. We need to do everything we need to do in education to really create a health human resource capacity safely, but faster. We don't have the luxury of doing it the same old way, not just in education, it's in everything, which means our view of clinical placements have to change, our view of who clinical faculty are have to change, because nothing can be a rate limiting force to stop the view that we have to create health human resource capacity our citizens need it. The second pillar is scope of practice expansion. And in scope of practice, this is an area very near and dear to me because I do believe we all deserve to live our true potential in the world, whether it's on personal fronts or professional fronts. So in this day and age, it's not acceptable when nurses are working at 40% of what they are capable to do, or nurse practitioners still have barriers underway in their practice. The barriers just have to be removed and people should rise to their true capabilities. So our biggest lifts in scopes of practice are in the area of nursing and pharmacy. And then we have many other scope of practice expansions going on for disciplines like paramedics, midwives, even naturopathic medicine. We are touching every professional group that we can, but the heaviest lifts are in the areas of nursing and pharmacy. So for pharmacy, you've seen all our work on minor ailments. The fact that if you have a pink eye, you don't have to now wait in a doctor's office to be seen. There isn't a single gatekeeper anymore in the system. It's an equal playing field for all healthcare professionals. You can go to a pharmacist and they can assess, diagnose, and prescribe the medication you need for pink eyes or urinary tract infections, things we actually diagnose ourselves and go and get over-the-counter medications. We don't have to sit and wait for services is the view behind scope of practice. And for nursing, we are about to launch our RN prescribing program. We are hoping early in the new year, and we've already implemented RPN initiation, and we've removed further scopes of practice barriers away from nurse practitioners, and we are now delving into the space of NPs and mental health. So it's really looking at those traditional things that stand in the way of people, not allowing them to do their rightful work, and we remove that scope of practice barrier away. So again, the colleges and universities have played a significant role in helping us with scope of practice expansions, but also kudos to the College of Nurses for rising to this challenge as well and helping us write the regulations, all the stuff you need to do to make scope of practice come alive. The third area, I'm very proud of this area because Ontario leads on this one. Scope of practice, by the way, we are stragglers. I just want to say other provinces have done some stuff much ahead of Ontario. So we are catching up to other provinces, but in the area, this third area that I'm going to mention, we are leading. And this third area is expedited pathways for interjurisdictional and international nurses. So the pride that I have is, number one, we are doing it under ethical recruitment. So I grew up, I'm an immigrant to Canada. I grew up in Tanzania. I'm not going to go to Tanzania and steal their nurses. I won't do it. In fact, I would quit if I was made to do it. So it's not about going and stealing and creating contracts with countries to steal their precious human resources. But if a nurse from Ghana, a nurse from the Philippines, a nurse from India, the UK, it doesn't matter. If a nurse chooses to come to Ontario themselves and they are waiting in the queue to get registered, we are going to remove the barriers away so they can practice and practice to the skill that they have. So we are the first jurisdiction in Canada that is now allowing what we call as of right. The as of right legislation was if you're a nurse and a member in good standing in your own jurisdiction, any other jurisdiction in Canada, you can just start to come and practice in Ontario. We will recognize Canadian licensure, basically, for nursing, for physicians, lab techs, and respiratory therapists. Because it doesn't make sense, right? When you've gone through the same curriculum, you've written the same exam, how do I not recognize a BC nurse? Why can't she or he just come and practice in Ontario? So we've allowed that now in Ontario, but we say, you know, come and practice, but do get registered with the College of Nurses. We don't want unregistered people floating around the system, but let's remove those barriers and move to a national license scheme for nursing. So Ontario is pushing that even federally. And then for international, you should be very proud of the work we've done in Ontario to remove barriers from international nurses. And again, big kudos to the College of Nurses. There is a new CEO at the college, Sylvie Crawford. She's emancipated regulator, and she doesn't use traditional threats like, oh my God, this is not safe for patients, to allow a nurse from, I don't know, the Caribbean to work in Canada. Her question is, why not? Why not? Why should 7,500 nurses be waiting in a pipeline to work when we have such a shortage of nurses? And are we artificially putting systemic biases in the way, not allowing them their true potential? So very pleased to say, folks, we not only registered a historical number of new nurses in 2022 in Ontario. So we registered about 15,000 nurses, almost half of whom were international nurses. We've never seen that in Ontario. So very, very, very happy to see that. And then the last pillar is retention and distribution of healthcare professionals. I would say I'm half pleased with the work we've done in that bucket because there's so much more work to do on retention. The types of work we've done are incentive programs, incenting someone to come to be a PSW or a nurse, incenting a nurse to work in the north, incenting a physician to take some shifts in the north. It's very, I wouldn't say foundational retention work, but our partners, our unions and others are doing some foundational work, and I'm very proud of their work. So you've seen recently ONA negotiate a contract for hospital nurses in a contract we've never seen before, increases we've never historically seen before, because competitive compensation matters in this economy. It matters. The world is our oyster. We can work anywhere we want. So if we are not going to fix compensation to the right level, people will move and choose to work elsewhere. And then workplace culture is the other piece we have to tackle in order to deal with retention properly. I want to let you know I am very driven by evidence. We carefully look at our data. Our attrition rate for nursing, for example, has increased by 1% year over year. So regardless of some of the rhetoric we hear in the media, the sky is falling, oh my God, everyone's leaving the profession. You know, a little bit more people are leaving the profession, but we have a net new growth of healthcare professionals of every type in this province, including nursing. What's happening is people are leaving workplaces. They're not leaving nursing, but they're leaving sectors. They're hospitals, long-term care facilities, in search of jobs that will pay them better and that will give them a better life balance. That's the phenomenon we are seeing, and that's the challenge that we have to rise to. I will stop. The last thing I will say is we also have this big piece of work we are leading. It's coming to fruition, where we've now articulated for Ontario a 10-year capacity plan. So taking a long-term view of things so we never find ourselves in the dilemma we find ourselves today. A 10-year capacity plan means envisioning what the healthcare system needs to look like 10 years from now, and then what are the health human resource considerations that we have to push on to build that future of tomorrow. So a lot of work to deal with the here and now issues, but also the issues of tomorrow. And the last thing I'll say on vacancies, Leanne, is the vacancies that we are seeing, and they are significant, are a result of two things. One is this increased attrition we've seen and the movement of people between sectors. And then even more so, it is the capacity we are building in the system. So here we are in the midst of our health human resource shortages, adding 3,000 hospital beds in the system. We are building 30,000 long-term care beds in the system. We are putting 4 hours of care in those beds. So the stuff that the pandemic blew open, we are trying to fix, but on a health human resource shortage, if you will. So we are feeling the pressure of it even more so. But the numbers, I'm very pleased with, Leanne. I'm driven by numbers. I want to follow the facts. And in aggregate, I'm not saying there will be sectors who are not struggling or organizations that may not be struggling. In aggregate, the numbers are moving in the right direction. And I'm very pleased to see that progress in Ontario.
Very exciting. Thank you, Dr. Velji. I'm going to turn over to Dr. Link Shear now to provide an overview of RVH's and Georgian College's partnership.
Thank you very much, Courtney. And Karima, every time I hear you speak about the 4 pillars, I'm even just more and more energized and inspired by it. And first of all, I also cannot believe you've only been in the role for a little over a year. You have been busy. You have been very busy. God bless you.
It's true.
I think it's true. Oh my heavens. So I think when I hear about this, and I hear about it from the language of the Horizons Project and what RVH is trying here to do, it hits all of those pillars in all actuality. It looks at the health human resource aspects. It really looks at how do we optimize the scope of practice and the knowledge of the healthcare human resources that we have. It is unbelievably innovative. And what I'm really proud about is that it builds upon an already very long-standing partnership between Georgian College and RVH. We are next door neighbors, but we are also great partners in terms of supporting student learners and supporting academic excellence. So with building upon that, I was really pleased to be invited by Leanne and the team and part of the initial discussions about the Horizons Project, because I think this is a great example about where, again, academic partners and our community partners come together to address what I kind of refer to as those wicked problems. And how do we bring together different subject matter expertise? So again, Karima, you mentioned as well, our evidence-driven and data-driven, the Horizons Project is evidence-based. We looked very clearly at what does the literature already tell us about models of care? What are the tools that are available to us that will adequately give us to do that internal scan? And it is also very data-driven. We had very early conversations at the very beginning about, okay, so what are the metrics we're going to look at to tell us whether we're on the right track? Is this getting us where we wanted to go? So I think there was a huge recognition of the importance of that, but also the excitement about it from the team level. And what I can also tell you, so from an RVH perspective, it brings together the expertise, my personal passion about this project, but also the collective expertise of the nursing faculty at Georgian College. And we are very proud of our role in contributing to the human resource pipeline for our partners. But then also from a Georgian College perspective, to be involved and to hear you speak, Karima, and to understand what's happening from a provincial level and to work with our various partners, this helps us to truly understand what does practice ready mean. And I say it over and over again. So I tell you, you tell me what practice ready is, and I will do our best to build that into curriculum and labs and simulated experience and clinical experiences that will truly support the smooth transition of our future colleagues into the practice setting so that they also stay in those practice settings as well. So that's what I'm really excited about in terms of this, the Horizons project, Georgian College's role in that, and how we can continually help to support our nursing leaders in various sectors and various forms of leadership to deal with the nuances and the continually evolving landscape that is scope of practice and health human resources innovation. So I'm really thrilled to be here today, and I look forward to the rest of the conversations.
Thank you, Dr. Langshire. Thank you both for joining us. And finally, Leanne, would you like to tell us a little bit about the overview of the Horizons project?
Thanks so much, Courtney. So, like Sarah said, when Dr. Velji first came to us in the North Simcoe Muskoka region and talked a bit about her vision, and yes, wow, super busy and has accomplished so much in a year. What really spoke to us here, trying to be super cognizant of the growth in our region, like Karima mentioned, and also, looking at delivering excellent care. What really spoke to us was about this heavy lifting in the system that we are faced with over the next few years. And we reflected here at RVH and really started to think about, what do we need to do to help with our portion of this heavy lifting? How can we use our awesome partners like Georgian College, who, as Sarah perfectly said, we rely on so much for our pipeline and really work with to make sure that we've got staffing and health and human resources to support our patients. And so how can we really look at what we can do here at RVH and that will meet these needs of our patients, and also look after our workforce? It's competitive. We cannot stay with the status quo. And like you said, Karima, innovation, we need to be thinking differently and not just within our box. So what we did was we began to explore the literature, started looking at evidence, and starting to really think about shifting away from this. How do we shift away from this ratio-based model of patient assignment and start using, kind of going back to more of the having the patient guide your acuity. How does the patient tell us what they need? Who needs to be at that bedside based on what the patient needs, and not some of this older, more rigid, black and white kind of thinking? So, like Sarah said, we engaged our partners at Georgian College and really started to think about things like scope of practice. How are we preparing our workforce for these kinds of shifts? We know we're in good company with other hospitals in the province. We've leveraged some of those learnings and relationships. And like Sarah mentioned, we've landed on 2 really good evidence-based tools, along with, which will be super important and key, is the important input from our frontline staff. So really looking at how do we leverage that experience, knowledge, and develop recommendations for each of our units. So we expect to see the outcomes from this work that will inform opportunities for improved collaboration between regulated and unregulated clinicians, looking at scope of practice in some key areas across our inpatient units, certainly in our emergency department. And as you heard from Dr. Velji today, it's going to be really important as we're looking to attract a satisfied workforce to come. Not only do we want to ensure that our experienced nurses feel that they are well supported and they can mentor and onboard and be excited about the care we're providing, but we also want to be attractive to the new clinicians that are exploring healthcare as a future. So ultimately, we're looking at this project as a mechanism by which we can really support our organization shifting from a ratio-based staffing model to an evidence-based one centered on balancing workloads, meeting patient care needs. And it feels, this is big change. Like, we're talking about really thinking differently about how we deliver care in Ontario. And I'm grateful that Karima and Sarah are both here today to help us in guiding and supporting some of this work. And we know it's unfamiliar. It's going to be a little bit different to start thinking about things in an it depends kind of mindset, and really really engaging our bedside staff, our frontline staff, understanding the departmental nuances within our clinical areas. We're excited to say we've started the work on 2 clinical areas so far, and we're really looking forward to the recommendations and learning along the way. And I think this panel is just another great example of how we can collaborate and use the learnings across not just our region, but the province in helping us think differently as we move forward. Thanks, Courtney.
Thank you, Leanne. So the next part, we are going to be moving into the Q&A portion of our panel. So please feel free to pop any questions that you have for our panelists into the chat. But we'll start off with a question for Dr. Velji. How do you see this work impacting our future?
There is no choice. There is no choice but to embark on this. And if you look at our 10-year projections based on population growth and demographic shift, we will never recruit and retain our way through the gaps that we have between supply and demand. The population growth in Ontario has far surpassed now any projections we had made even a year ago because of the immigration pathways that have opened up. People choose Ontario, as you know, as a lucrative place to come first. So if you just follow the data, follow population growth, follow demographic shifts towards the aging population, by 2032, our people over the age of 75 will have increased by 49% in this province. And these are understated numbers, by the way, is what we are beginning to see as well. So there's always going to be the supply-demand gap. And in the gap, in my opinion, lies the opportunity to think differently. Because you can try and say, you know what, but I want to fill it the same way. I want to do the same things I used to do 10 years ago. Well, you can't, because the gap is you have to think very innovatively. So I think your project is probably leaning in that direction of you've faced your reality, you've lived with it for a number of years. There is no choice. You have to move in this direction. And I would say be bold as you move in this direction. So it's not only about who could do this work. For example, who could do the work traditionally that only nurses have done in an inpatient unit? So not only do you need to think that, but then you have to also think about, and where do we want our registered nurses to be practicing? Look at all the people ending up in hospitals who don't need to be in hospitals. Is there upstream work that we have to lend our RNs to so that they are keeping people healthy in the community? They are preventing the emerge visits, the recurrent admissions, the ALCs. So think on both fronts, really elevate the roles of people like registered nurses, nurse practitioners, physicians. We need to be doing different level of work and then allow up to lay caregivers to do the other work that needs to be done. Because guess what? When we discharge patients, who's looking after the ventilated patient at home? Or the patient who has dialysis at home? Either the patient is doing it or the caregiver is doing it. We do teach caregivers. They have a lot of capacity to do a lot. But, you know, and we don't have the luxury of every type of person we need right now in the system to be doing that. So for me, I see it like, you know, every crisis or urgent situation is showing you a way to the future, should we choose to see it. There will be those of us who close our eyes and put our head in the sand and say, no, it has to be the same as it was. And then some of us will say, you know what? The alternative is canceling surgeries on patients, making them wait for more services. Like, what is the alternative when we take silly positions and draw lines in the sand that don't make sense anymore? So kudos to you for facing the future and the reality as it's presenting to you.
Thank you, Dr. Velji. So our next question, I'm going to pose this to all the panelists. What does this mean to quality of care for patients, as well as our frontline staff satisfaction? And we'll start with Leanne.
Sure. Good, thanks, Courtney. Like, I think, whenever we have these conversations, it is so inspiring to me. And I think, what does it mean when you really think about, what does it mean for patients? And I think what it means is that patients should have confidence that, we are continuing to design and redesign a system that will be responsive to their care needs. And so what it looks like, we'll stay with that whole, like, it depends. So it really does depend. We're trying to remove these barriers to collaboration. We're trying to elevate our regulated and unregulated providers, and we're looking at really culture shifting and mindsets, and really moving towards, this whole concept of ensuring that we have the right composition of care provided to the patient based on what that patient needs. I love what you're saying, Karima, about the lay caregivers. And, you walk through the doors of a hospital and suddenly, we're the only people that can provide the care in the best way. And so it's really shifting that thinking and forcing one another to be bold. I love the way you inspire that kind of language, and really something else I read about you, Karima, is this concept of nursing really establishing themselves in the system as healthcare leaders and driving innovation. So that concept is so exciting to me. So I think ultimately, what does that mean for our workforce? What does it mean for patients? It means they can have confidence that we're doing what we need to do to continue to provide the care that we commit and is our privilege to provide to patients that we serve here.
Thank you. Sarah or Dr. Velji, if you have anything to add as well.
I'll just add really quickly, I'm also picking up on the comment in the chat about virtual teams. And I think that's another part about just recognizing where care is being delivered and how care is being delivered. And I think what we really need to take advantage of, we have never had a more knowledgeable nursing workforce than we do today. So we really have to look at how do we take advantage. I know, and I'm very pleased to see some of my colleagues are here as well today. We work really hard to provide our future nursing colleagues with that knowledge and skills and judgment that they need. And there's nothing more frustrating as a new grad than to be told, sorry, we don't do that here, or that's not how we do things here. So how do we keep them engaged and invigorated with all that knowledge and to continually expand their knowledge? As I think is another great way of retaining that nursing workforce. And at the end, the patients benefit from that. They benefit from the care delivery by the application of all that knowledge and collaboration within different teams, and looking at different care delivery models. So what we've had some experiences, and we're looking at, so what are the competencies to deliver care virtually? It's a very different experience. So how do we prepare nurses to deliver care in a virtual environment as well, is also something that we also have on our horizon.
We've been looking at some models in the world, basically, and where are people innovating, etc. There are some jurisdictions in the US where some cool innovation work has taken place, where they've taken actually all their sick time modified workers, basically, and put them towards virtual work, and created virtual hospitals with no beds. It's virtual. So it's very, very cool, because you could do that work. You're admitting people, triaging people, discharging people, completing their paperwork, all of the assessments, everything virtual, and preventing the level of admissions as compared to the hospital next door. There is not even a comparison. And they've been tracking their outcomes. And the outcomes are the same between the population who went through an emerge room that had beds associated with it versus the emerge room that was a virtual hospital. Because you know very well, if you build a bed, you fill it. If you don't have a bed, you will find a way to innovate around it. And people are pushing in that direction of out of hospital, outside of the four walls of the hospital solutions. Just by virtue of growth of population, we will need to find those solutions, folks. And the practice ready concept, Sarah, I'm a much for clinical scholarship. Like for me, it's a responsibility of both the education institution and the care organization to join hands to create a practice-ready nurse. We can't be pointing fingers at each other to say, well, they are not creating the nurses we need. Oh, okay, what have you are the clinical lab, you are the clinical environment. So how have you partnered to create those seamless opportunities so that at least in nursing, we should learn, I think, from our physician colleagues and others who do this practice education relationship in a far stronger way than we do in nursing. We have these artificial divides, and I think we need to tear those down. So I'm pushing, like compression of education programs is the next frontier we will push on hard. We can't wait for 4 years to create a nurse. We can't. We are in a dire situation. So we'll be saying, okay, if we want to move to 3, but it's still a baccalaureate entry to practice. So I don't want to dilute the education standard. Where's the innovation here? How can we deliver that and create practice readiness? So can extern hours, for example, count as clinical practice hours? What portions can be done in a simulation lab? Can the notion of faculty change? And then can we put our arms around clinicians and call them faculty? There's so many traditions I think we have to face and deal with in the profession, basically.
That's great. Thank you very much. Those I know that we are coming up on time. I do want to ask one question because what Dr. Velji just mentioned about compression of time in school made me feel uncomfortable. So Dr. Langshire, how can we become more comfortable working with I don't know, it depends?
Okay, so it is one of these things where I love Karima's, like, we just have to get comfortable with it. It depends. We have to get comfortable with the impermanence of scope of practice, and it continues to evolve. And when we talk about things, particularly like scope of practice and getting our heads wrapped around certain things, I always love to pull out, for those of us that have been around for a while, I don't know if you remember the little blue books from the College of Nurses of Ontario. And I'm so glad I never threw this out. But this used to be the book of literally who was allowed to do what. Is a tick box. We don't do that anymore. We have to think our way through this. We have to look at multiple different factors. And I welcome the challenge about, how do we deliver education differently? How do we look at clinical placements differently? And I think we're all going to be challenged to be bold because, as you said, the external environment just can't wait for us to get over ourselves, to be perfectly honest. So I think this has been a great, invigorating conversation for all of us, whether practice, research, policy, academia, come together to try to be really, really bold and come up with some great partnership opportunities. And I'm just really thrilled for the conversations here today.
Thank you so much. So I want to thank everybody for joining today. I want to thank our panelists so much for joining us, Dr. Velji, Dr. Langshire, Leanne, for coming together. I think to wrap up, could maybe we just have maybe one thought on any advice if we're on the right track from each of you. Dr. Velji, start.
It's advice I give relentlessly to myself because I have to follow advice in order to give it. I think we have to be fearless. Kind of suspend the traditional fears about this and that and try something. And it's okay if we don't succeed. We can shift our approaches, but try something different, try an innovation, join hands. I think a united front between academia, education, practice. We need to hold hands to face the future that's at our doorstep today, basically.
Thank you. Dr. Langshire, any last
absolutely. I think it is, so congratulations again to RVH for taking the bold step to just getting started. The first step is always the most uncomfortable. And so, but that's the only way that we can actually go forward. And I look forward to, as your partner with Georgian, to supporting you every step of the way.
Thank you. and Leanne, our fearless
Well,
leader on this project.
This has just been the best 45 minutes that I can ever think of having. And I am just so inspired by both Dr. Velji and Dr. Lancashire, and so truly grateful for our partnership with Georgian College, because I feel, you've done this, I feel like this with our relationship. It's excellent. So we are in many ways feeling ahead of the curve. And, I'm thinking about all these quotes that come to my mind. You're criticized for not changing. You're criticized for making a change. So I'm going to end and have my last thought be the courage to be bold. So I'm going to challenge everybody who's been listening, who will watch this, is let's trust the process. Let's trust each other, and let's be bold, and let's see what we can do different. Let's innovate. Let's be courageous, and let's inspire the new nurses, the new healthcare providers that are looking to join this amazing job of delivering great care to patients in our community. So I'll stop with that. And I just want to, with the bottom of my heart, thank you both for joining us, and thank everybody. And Courtney, I know you're going to do a quick wrap up. So thank you for your time. It's so precious, and we appreciate it so very much, both of you.
And Leanne, keep your eye on the patient. I think if we
Yes.
keep on putting our eye on the people we are serving, we won't we'll always, I think, land on the right place. We may take missteps, we may make a mistake, but if our sight is set on the people we have to serve and what's good for them, everything else falls in place after that.
Perfect. That was a perfect wrap up. Thank you again, everyone. Thank you for joining. As we said at the beginning, this will be recorded and available for you once it's completed. Please scan the QR code, visit our website. We'll keep you up to date through this week at RVH. We'll see you out on the floors with the project team, and any feedback, questions, please submit to horizons@rvh.on.ca. Thank you, everybody. Have a wonderful day.
Thank you, Courtney, for
Thanks.
hosting. Thank you.
Thank you, everyone. Bye.
Bye.